everybody, and welcome. Welcome to today's Pharmacy Hot Take, tracking your clinical intervention outcomes. At URAC, clinical interventions and their outcomes have been an area of focus for the pharmacy team recently. We also recently released a paper entitled Specialty Pharmacy and Clinical Intervention Outcomes. I think we're going to have a link to that paper in our chat. And in this paper, we talked about the importance of clinical interventions and specialty pharmacy practice. And in that paper, we interviewed Jen Donovan from Shields Health Solutions about her experience with clinical intervention outcomes. So today, Jen and I are here. This is Heather Bonome, and I am the Director of Pharmacy with URAC. And I'm going to facilitate and lead a discussion with Jen Donovan, who's the Vice President of Clinical Services with Shields Health Solutions. And we're going to do a pharmacy hot take for you. Before we get started, you are all pros at Zoom, but if you do have any technical issues, we have Nick Davis available, and you can message him and he'll make sure that you get all squared away. If you are new to URAC, you'll see that our general webinar style is to keep the chat box going throughout the webinar. And we'll do this for questions. We'll do this to share resources. You can introduce yourselves. So we like to keep that going. And we've got some folks on the line, including Lisa from our education team, who are going to be sending out some links and information and moderating and managing the chat for us to make sure that we get all of your great feedback there. Today's a pretty quick session. We're just here together for about a half an hour, but if we do have time at the end, we will take questions, and we'll do those questions through the chat. Also, throughout our discussion, we're going to pose some questions with you because, again, we want this to be a discussion. We want to hear from you as well as to have you hear from us. So when we ask those questions, we'll ask that you chat your answers into the chat for us. All right. Okay, so what are we going to cover in this next half an hour? So just some quick level setting. I'm going to do a little bit about URAC. I'm going to offer for Jen to spend a little bit of time telling you about Shields, and then we're going to really get into the meat of our discussion. We're going to talk about clinical interventions, why outcomes are important, and how all of this aligns with specialty pharmacy accreditation. All right, just some brief level setting about URAC. So URAC is a leading national accreditor of healthcare organizations. Our clients are specialty pharmacies, community pharmacies, mail service pharmacies, also hospitals, health plans, telehealth providers, companies, case management, disease management. But likely you are here today because you know us as the leader in specialty pharmacy accreditation. So let's take a little closer look at our specialty accreditation. Great, so we've been doing specialty pharmacy accreditation for a long time. Our first program was launched in 2008. We now have more than 500 organizations that are accredited for specialty pharmacy under our program. And we are currently accrediting under version 5.0. So about a little over 6 months ago, in October of 2022, we released a revised version of our standards. This is a significantly streamlined version of the program, and we're really excited about it. And that's what we're accrediting under right now. And clinical interventions and their outcomes are more of a focus in this version than we've had in the past. And that's one of the main reasons we're here talking today. And as many of you know, this is an important program and very relevant in the specialty pharmacy space because in the majority of cases, a lot of payers, a lot of manufacturers have recognized this accreditation program for participation in a network and or access to limited distribution medications. And Jen, I'd like to invite you to introduce the audience to the Shields Health Solutions.
Great, thanks Heather. Welcome everyone, glad to be here. Shields is an organization that helps health systems develop and operate specialty pharmacies. We started a little over 10 years ago with just one health system, UMass Memorial, And since then, we have over 70 different health systems that we support in different capacities. Of our health systems, just about 50% is managed or are managed by our clinical pharmacist, and we do the PMP for. So we have worked closely with URAC, and I'm really glad to be here.
Yes, and thank you so much for joining us and for working with us on the paper that we recently released. Okay, so let's dig in. So healthcare reform has been a hot topic for decades now, right? We have had a lot of focus has been on moving to the value of the care that is being provided. And pharmacies, and especially specialty pharmacies, provide critical patient management services. They make sure that the therapy is effective and works for the patient, hopefully while optimizing cost and managing the value. Among these patient management services are clinical interventions, which can require a lot of pharmacy resources. So how do we know the value of these clinical interventions that are essential to patient care and requiring a lot of resources? Well, we need to track the outcomes. So let's talk about some definitions, right? What is a clinical intervention? And very simply, a clinical intervention is an action taken by a clinician to address a patient's issue and or improve their care. And in a minute, we're going to give you an opportunity to chat in about some of the clinical interventions that you're conducting, and we're going to let Jen talk about that too. All right, so the next, what is a clinical intervention outcome? Also, pretty simply, it is what happened as a result of the clinical intervention that was performed. And then again, why do clinical intervention outcomes matter? Well, there's a lot of reasons. I mean, first and foremost, a clinical intervention is being performed to address a patient issue. How do you know if the patient benefited from the intervention or the action that was taken if you're not looking at what the outcome was? Also, as we mentioned before, the patient management services, those clinical interventions performed by your pharmacies, require a lot of resources, and you want to make sure that you are maximizing your resources to provide the best patient care. Then these outcomes can also be used to demonstrate the value to different stakeholders. So think about the internal stakeholders that want to understand the value of the services that your pharmacy is providing. Do you need to demonstrate that value to get more staffing, to get some additional funding for resources? And what about external stakeholders? You know, are there providers and you're looking for them to send referrals to you? Are there manufacturers and you're looking to access an exclusive distribution drug or a limited distribution drug, and you want to show them the value of the services you're providing? As well as payers, how can that assist in your payer relationships by showing the value of the different clinical interventions that you are performing? So we'd like to pose a question. And again, you can type it into the webinar chat. What are some of the clinical interventions that you're conducting at your pharmacy? See if we see anything coming through. Thank you. Thank you, Joe. Helping patients with adherence. There you go. Immune globulin. I think it's adverse reactions that scrolled up a little bit fast. Perfect. Changing the dose, making sure you're addressing an inappropriate dose, optimizing the dose, managing adherence, managing adverse reactions. Absolutely. Maybe a change in therapy, helping to reduce the cost of out-of-pocket cost to the patient. Absolutely. That's a great one too. Affordability, injection training. Perfect. Perfect. And some immunization recommendations, looking for completion of therapy. Oh, well, these are great. This is wonderful. And that's great. And this is really going to set a great foundation for the rest of our discussion. And at this point, I'd like to give Jen an opportunity to talk about how Shields Health Solutions started with tracking clinical interventions and their outcomes.
Yeah, thanks, Heather. I agree. These are some great interventions folks are doing, and you'll still see here on our slide, there's a lot of similarities here as well. Where I thought we'd start is really what our approach was to document and track clinical interventions. We first started with the design, and we used the medical literature to help frame what that design would look like. Most specifically, we wanted to know what pharmacist interventions are considered most impactful. And we came up with the list. And then we really organized the list into buckets or categories to help us streamline the similarities between them. So a couple of examples of intervention categories would be safety or adherence, just to highlight a few. And then lastly, we took the literature to determine what would be the anticipated outcome associated with that clinical intervention. So for example, if we made a dose change, why do we make the dose change and what do we think the outcome would be with that? And so each intervention would have potential outcomes associated with it that we used the literature to kind of make that connection and ensure it was evidence-based. So you can see on the right-hand side of the slide here, you can see table 1, which illustrates this framework. If we look at the top row, starting with safety, we guide our pharmacists to use this in specific situations. And you can see here, select when an adverse drug reaction may be present, or it could be selected if a contraindication exists or drug allergy exists. So as Heather mentioned before, it's the action the pharmacist takes to really pivot the patient care that we're having folks utilize and make these selections. And then depending on the patient scenario, there's a list of outcomes that the pharmacist can select that they believe would be associated with that. And this can be preventing an adverse drug reaction. It could be preventing therapy complications or improving adherence or eliminating a drug interaction. So there's lots of different options. Again, we allow our pharmacists some clinical judgment to see what would make the most sense. Below in table 2, you can see that each outcome has a corresponding anticipated cost avoidance. And as you can imagine, there's a lot of variations here, but we wanted to start somewhere. So you can see the framework in table 1 and then continue in table 2, where in table 2, the example of preventing a serious side effect, we had found a cost avoidance of around $700. So once we had the framework, we wanted to figure out how best to implement this approach. So we started with creating a rule book that had definitions of what each category meant, when to select the specific intervention type. And we gave examples, again, just to help illustrate that point. And lastly, kind of how to document in our patient management program. And our thought here is, we know we have a large team. There's going to be different scenarios. We really wanted to level set within our team what the expectations are. Moving to the next slide, once we started documenting clinical interventions, we wanted to say, what does it mean? This is the evaluation part of it. And so we wanted to look for trends to identify patterns of success, but also looking for patterns of opportunities. Where are there ways to better care for our patients? And so on the right-hand side, you can see table 1. We organized the intervention categories that I referenced in the previous slide. And across the top, you can see these are therapeutic categories. Below on the slide is the abbreviation. So if you look at the first column in blue, AD, so atopic dermatitis, you can see our top categories of interventions are drug safety, adherence, and effectiveness. Below in table 2, what were the outcomes associated with those interventions for the different conditions? And we can see there's improved adherence as an example, as well as preventing some complications. And so we track this over time to see, are these the recurring interventions and outcomes, and how can we make changes in our care model to better address the needs of our patients? And as Heather mentioned, we use these data to share with each of our health systems to demonstrate the value the pharmacist is providing to the patient, but also to manufacturers and payers, that just the detail that specialty pharmacy has when they engage with patients. The last box, limitations. So our approach is not without limitations. As you can imagine, there's lots of variations in the literature in terms of cost avoidance. We opted to select the cost that was the lowest to be most conservative in our selection. And certainly the variability that I mentioned as well is that pharmacists may document differently, which also might impact the data in aggregate. So we do believe these interventions are important, so we continuously assess how can we improve it to make sure that we're really representing the care our pharmacists are providing. So Heather, this is our story of how we approach it. I'll hand it back to you and love to learn more about what the rest of the group is doing.
Thank you so much, Jen. It's really helpful to understand the steps that you took, from the research to the setup, to the training of staff, to the evaluation, and also recognizing that there are limitations to this when we're implementing it, but recognizing that, and also recognizing the value of how this helps us to evaluate the services being provided. That was really helpful. So we're going to take another look at the chat, and we'd love to hear from you about what clinical intervention outcomes are you tracking. So you shared many great clinical interventions that you are conducting for your patients. How are you translating that into outcomes? What does that look like at an outcome level? Reducing or eliminating adverse drug reactions. Thank you, Joe. I think you were the first one to respond to both questions. You get a gold star. All right, any others coming through? All right, and again, it was really helpful. Oh, there we go. Assessing the level of, there we go. Tracking whether a patient's accepted the intervention. Also very important, right? The patient has to be on board. That's a great one. Wonderful. Tracking if the physician accepted the recommendation also, and making sure that those interventions are done in a way that is going to set you up for success with the acceptance. Absolutely. Perfect. Well, we can keep those coming through. At the start of our webinar, I referenced that we are currently accrediting under the Specialty Pharmacy version 5.0 standards. This slide here is a snapshot of all of the different focus areas that are included in this program, and patient management is highlighted in orange. I'll often say that patient management is the focus area that makes a specialty pharmacy a specialty pharmacy. So those are the clinical services and really what we've been focusing on today in our discussion. In version 5.0, we have a standard. We've got it up on the next slide. Perfect. That the patient management program services include clinical assessments and interventions that utilize drug and or disease state specific clinical processes and workflows. What we've had in prior versions is we are looking for some clinical assessments, initial assessments, reassessments. And in prior versions, we were also looking for pharmacies to make sure that they were conducting clinical interventions to optimize patient therapy. What's new with our famous gold star is the documentation of intervention outcomes, and then analyzing and trending intervention outcomes data. So looking at the aggregate data of what you're collecting on those outcomes and being able to determine, are the services that we're providing what we're hoping to do. And again, that's important. It's important internally to know that those interventions that are being performed are meeting the patient's needs, are being accepted by the physicians, and are resulting in better patient care. And collecting this information allows you to demonstrate your value to your different stakeholders. So we've got one last question that we would like to pose to the group. How are you using clinical intervention outcomes data? So we're going to put that in the chat. And Jen, I'd like to pose that to you to kick this off, please, and warm them up so that we can get some more feedback in the chat.
Yeah, no, thanks, Heather. I think oftentimes, looking to get access to limited distribution drugs has been a challenge for many health systems. And so we take these interventions and kind of layer them over the assessments that the pharmacists do to really show that as the pharmacist is engaging with the patient, what does that result in? And oftentimes it could be improving in adherence or managing side effects. So it shows the depth that the clinical pharmacists are providing. And so we use it in a patient journey format. So showing the patient's journey from the beginning of therapy over time, the number of assessments and the types of interventions has been a great use case for us.
That's excellent. That's a great example. In the chat, I see that Joe once again gets the gold star, determining effectiveness of our adverse drug reaction prevention interventions. Absolutely. Fantastic. Let's see what else we see here. Showing value to clients, showing value to manufacturers. Absolutely. Showing the value to your health system. Mm-hmm. Exactly. And really that is what we heard through the revision process. When we're revising standards, the primary way that we learn and that we introduce new concepts to our standards is through our advisory groups. And we held advisory groups when we were revising the specialty pharmacy program. And that's what we heard is that, okay, great that we're conducting clinical interventions, and what does that mean? And so adding this requirement to the standards is in some ways, in some cases, introducing the concepts to pharmacies so that to help them realize, hey, we're doing all of this good work. Now, if we take it a couple of steps further and track it, then we can really have more information about these services to show what our value is.
I think that's a great call out, Heather. Just to add there, I think this is stuff that the pharmacist or clinician already does. So it's not really new things. It's just that documentation part that I think really helps underscore the value. So really capturing all that work that the clinician is doing is so important. So I'm really glad you called that out.
Absolutely. And I see a question here. Does URAC define what outcomes data a pharmacy needs to measure? And so no, URAC doesn't define that. The pharmacy is going to define that as part of their design of the patient management program. So it's really based on your clinical practice, what interventions make the most sense for your practice, and then how are you tracking the outcomes, how are you trending and evaluating that data so that then you can inform, do we need to make an update on some of the services that we're providing? So when an auditor is coming, we're not looking to say, hey, are you tracking A, B, and C? It's more, great, what are the interventions that you are conducting and where are you documenting that? And show us the outcome analysis that was performed. What was the outcome of that? And, did you make any updates? And so it's really that process, making sure that the pharmacy is adhering to that structure. That was a great question. Not only shows the value to support, it also helps generate discussions among the clinical team to improve patient management program. I think that's a great idea. You know, one of the things you had shared, Jen, was you have a lot of different clinicians conducting these interventions and tracking them, right? Taking this information back to them and facilitating discussions, I think could be very useful as well.
Yeah, no, I definitely agree. I think as you get into the day-to-day work, you can kind of get lost of like, what are some of the trends? So looking at those patterns and getting folks' input is really valuable. That's a great call out by Jessica.
Yeah, it is. There's another question here. You know, how are some of you who are already doing this collecting the data? Is there a certain software vendor? Is there an approach that you're taking to try to collect some of this information? Anybody has ideas? Feel free to chat it right in.
Looks like build custom assessments within our dispensing software, EMR, Epic, Theragy.
CPR Plus, so some of the different platforms that are available.
Yep.
Yep, building it in there. Wonderful. Thank you so much. So again, this was a quick hot take. We're at a half an hour. Up on the slide there is just sharing that anybody who is a URAC client, whether you're seeking accreditation or already accredited, you have access to our client information hub. We've got lots of webinars posted there, including webinars on the standards. So we have a patient management webinar specific to 5.0 that goes into this in more detail, what the standard is and what we're looking for when we're conducting audits. With that, I think we can go ahead and wrap up. I'd really like to thank everybody for joining us today. I'm very grateful to Jen for joining us and really sharing the experience that her organization had as they implemented clinical interventions and the tracking of those outcomes. Thank you so much.
Yeah, thank you. Thanks, everyone.